exterior of the emergency department at Karoli Lwanga Hospital. It was made possible through grants from the Tom Dooley Heritage Foundation and a very sizable grant from Dr. Clyde and Mrs. Peggy Von Der. We're very appreciative. And then it was the brainchild of two physicians, Dr. Mark Bazanzo and Dr. William Walsh, and so the room has been named after them. And this is the entrance to the emergency room.
Hello, you're welcome. This is Nyakibale Emergency Department. We wanted to give you a quick tour to say thank you for all of your support. I'm Dr. Heather. This is Honest, one of our nurses who will not smile.
She won't even look.
This is Dr. Stacy from the United States. This is Sister Felista over here, our in charge. So the very quick tour, this is right here, this is where we triage our patients. When they come in, we write them in the book and start taking their vital signs or information or observations on these charts that we have made. After that time, the nursing students and the nurses bring the patients over to the beds. Around here. First right here, this is our orthopedic area where we have an orthopedic technician named David who helps take care of all of the broken bones and osteomyelitis and other orthopedic injuries. Here we have our very exciting new view box that we just had placed this week so that we can look at x-rays, so that we may see them very well, so we can take care of our patients better than we would have been able to before. So thank you for your help with this. Here we have a ward screen that is for privacy so that we may separate some of our patients. In this cabinet we have filled with lots of supplies, books for our reference. We have all of our trauma supplies here and our orthopedic supplies on the bottom. Throughout our time here, we've created a manual for our training our clinical officers and nurses. It is about 50 pages long, which is very long, but we're hoping that they can learn lots so that they can continue the emergency department management without us. So as you can see here in this area, we have a lot of patient supplies. This is our autoclave where we can sterilize all of our things that we need to keep things clean for our patients. We have extra supplies on the bottom. We have a refrigerator over here for our cold medications to use. And over here in this closet, we have our drug cabinet, which we keep all of our important medications to keep all of our patients healthy and happy. Our pharmacists and our superintendent have been generous enough to help us keep a lot of oral and injectable medications here so that our patients can get care as quickly as possible so that they may start their treatment and get back to full recovery. Here we have 3 patient trolleys or patient stretchers and 2 more on the other side of the room. These are brand new as well with help from our sponsors, where we have IV poles on them. There are trays on them as well, and we can lift the top of the stretcher off so that we may collect trauma patients and move them around more safely. We also have these brand new lights, which we're very excited about. These were just installed this week again with the help and your support. They help us. We can move this all around so that we may shine it so that we can take care of the patients better and see what we're doing. So we have 3 other new large pieces of equipment that we wanted to say thank you for. One is our oxygen concentrator. This is one of the few ways we have to give extra oxygen to patients who need it, where we can connect tubing to here and goes to the patient. This has been extraordinarily helpful. The second is our suction machine, which helps us when people are having difficulty breathing because of too much fluids in their mouth or in their throat. That helps us very much as well. And this is our ultrasound, which helps us do quick bedside evaluations of people's abdomen, chest, and other concerns that we might have when we can't get a hold of our radiographer or when there is not time to move the patient somewhere else. So again, these are 3 big pieces that help us take care of our patients here every day. And so that is our quick tour. We just wanted to say thank you so much, and we'll continue to keep you updated on how Nyakibale Emergency Department is doing, and we'll see you later.